Hi, I'm Dr. Ryan. I'm a pediatric gastroenterologist based out of Kolkata. So recently, I had a child come to my clinic. He was having multiple episodes of pain abdomen for the last 2 to 3 months. Examination wise, child was otherwise fine. There were no red flags. Child was growing well. There was no weight loss. But the parents had done an ultrasound abdomen on their own. They had gone to their nearby diagnostic clinic. They had done an ultrasound abdomen on their own. Fine, I understand they were anxious. I totally get it. But so when they got the report was saying mesenteric lymphadenopathy, 6 into 4 millimeter, I think, or I don't remember exactly. So anyway, so they called their own pediatrician, I think, and the pediatrician told them that you need to start antibiotics, right? So I just looked at the report. There was nothing else in the report. There were no other red flags. There was nothing in the bowel wall, nothing in the liver, the spleen, and the child examination wise was completely fine. So let me explain what mesenteric nodes are. So mesenteric nodes are something, these are lymph nodes which exist in the mesentery of the abdomen. The mesentery is the protective covering for your intestines that God has made so as to protect your intestines from all sorts of things. And these lymph nodes are essentially immunity organs so as to create white blood cells to fight off any infection that may come through the gut. Okay, so we all have mesenteric lymph nodes, and in fact they are protective. And in fact, if you have a child who does not have mesenteric lymph nodes, which is highly unlikely, that is problematic. Okay, so even if they are enlarged in a child with having recurrent fevers, recurrent pain abdomen, losing weight, maybe having blood in stools, in that case we will definitely look at the mesenteric lymph nodes, especially when the size in the short axis is more than 10 millimeter. That is when the ultrasound report showing mesenteric lymphadenopathy is significant for me, and that is when I would prescribe antibiotics. So parents, my message towards you is that don't get worried if you do an ultrasound on your own. I would suggest first of all not to do ultrasound reports on your own. Don't go to a radiologist on your own. Go to a doctor first. If the doctor advises you to do it, only then you do it. And secondly, even if you do get it done, don't get worried by the report. Go to a doctor, let the doctor interpret the report, because there are many caveats, many nuances to medical science, especially in pediatrics, especially when dealing with children with abdominal pain. Thanks a lot. Stay tuned for the next one.